With that, it's my pleasure to introduce our next speaker, who'll be talking about the impact of pharmacists on influenza vaccines, Dr. John Papastergiou. Dr. John, can you hear me, and can you pop yourself on screen?
Okay, thanks, guys, and thanks for having me. It's evening here in Canada. I'm going to talk a little bit about the Canadian experience with immunization and kind of what we've achieved over the last few years. I am an assistant professor at the School of Pharmacy at the University of Toronto in Waterloo. I'm also a frontline community pharmacist, but in this respect, I was part of the team that was given the task of quantifying the impact of pharmacists as immunizers here in Canada. Before I get into my presentation, I do have some disclosures. I do quite a bit of speaking. Nothing that will impact the integrity, I think, of the presentation here. Nothing that would bias the presentation. And some of the research that I'm going to be talking about was funded by the Ontario Ministry of Health and Long-Term Care. So what my goals for you today is to talk a little bit about the role of the pharmacist in vaccination, what we've experienced here in Canada and where we've come and where we've gone. Review some of the evidence that we have. I think we're really one of the only countries that has some, I think, good pharmacist directed evidence. Discuss some of those barriers and facilitators that we experienced over the years as we implemented community pharmacy-based immunization programs, particularly for flu. And then I'll sum up some global examples of immunization programs and the successes that they've had. But like I mentioned, I'm first and foremost a community pharmacist. I own 5 chain drugstores called Shoppers Drug Marts. A very competitive environment, and I wanted to differentiate my practice, and I became interested in enhanced clinical services. So we offer programs like point-of-care screening, pharmacogenomics, and more recently, a huge immunization program that started with flu and then went on from there. So we will focus a little bit on my personal experience as well. Just before we get to all that, give you a little bit of the landscape of pharmacy in Canada. I think over the last few years, we've seen a tremendous change in the drug retail space. We've seen generic deflation, shrinking margins, dispensing medications essentially becoming a commodity. And over the last 5 years, we've seen, because of that, we've seen a decline in retail sales. And pharmacy as a profession and as a business has had to evolve as a result of that. We've centralized a lot of our dispensing services. So those traditional functions that were done in a pharmacy, filling prescriptions, many of that has gone off-site. It can be done cheaper at a reduced cost to fill. So you see a common dispensing facility here. Patients will order their prescriptions online or through an app, and it'll be available in the store next day. So we do fill prescriptions in the pharmacy still, but much of that has now gone centralized, and the pharmacists really spending more of their time on enhanced clinical services. We've had disruptors in the market as well. Amazon getting into the drug retail business as well, and this has become a reality in Canada. Alexa, refill my Nexium. Sure, Pete, I'll send it off with your next drone delivery. So my point here is, I think that historical notion of the pharmacist filling prescriptions, checking, getting them out, it's slowly disappearing. And I tell our students all the time that you really have to think about where you will fit kind of in the new landscape of pharmacy over the next few years. Canada is a big country. We're divided into provinces. I'm in that kind of middle orange province there called Ontario. But the scope of practice for pharmacists varies as you go from coast to coast. The green provinces there have the most advanced scope. Provinces like Alberta, where they have full prescribing authority, and then some of the other ones trailing behind. So there's kind of a mishmash of services that pharmacists are allowed to offer in different jurisdictions. Like I said, Alberta, they're the most advanced. You see all the green check marks. When I started, community pharmacy, this whole grid was was red. So pharmacists were essentially dispensing, counseling patients, making sure they got the right medication. But you flash forward now to 2020, there's advanced prescribing, minor ailment prescribing, immunization obviously has become a big deal. And you can see, depending where you are in the country, almost everyone offers flu vaccination now, but we're also able to prescribe and offer other vaccines, in varying degrees across the country. But the trend that you always see, and you see this actually globally as well, most areas or jurisdictions will start with flu as pharmacists get experience with the flu vaccines, and they do a good job, and patients get used to having that service. You'll see they expand out to other vaccines, including travel and whatnot as well. So I think the point I'm trying to make here is where that traditional role where we filled historically many prescriptions in store and offered some patient care services. The future of pharmacy in Canada, I think globally, will become one where we focus less on dispensing, most of that being centralized. And the vast majority of reasons patients come to the pharmacy are to get these enhanced patient care services. So I think that's where we're going, including immunization in many provinces. And many countries are already kind of on that road. Canada has a universal healthcare system, so it's free to go to a doctor, to go to a specialist or whatnot, or to seek medical care. The challenge has always been one of access. It is overburdened. 1 in 5 Canadians say they wait up to a week to see a family doctor. 1 in 3 say they have to wait at least 4 hours to get into the emergency room. And then half of the patients reporting they wait over a month to see a specialist. So when access, is an issue, I think the stakeholders have looked at pharmacy to help relieve some of this pressure. And Canadians trust their pharmacists. 94% of them have a positive kind of impression of their pharmacists, more so than doctors, teachers, police officers. And 4 in 5 feel pharmacists should be able to do more to help lower that burden on the healthcare system and give them access to the care that they need. And they want to get things like immunization. 70% of them saying they'd like to come to a pharmacy to get their flu shot. 80% of them trusting their pharmacist to provide advice on things like minor ailments. So that relationship is owned by the pharmacist, I think, in healthcare. It's expanding on that and being able to leverage that to offer these other services. And kind of that's the model we've followed, and the goal being to take about 17 million visits annually out of the physicians' offices and moving them into frontline pharmacies, allowing physicians to focus on the more chronically ill patients and helping with some of those wait times and the costs that are associated with hospital and doctors' visits. That being said, we'll kind of skip over and start to discuss flu and influenza. I know our last speaker spoke about the burden of it. Same burden here in Canada, but 175,000 emergency room visits every year, 12,000 hospital admissions, and 3,500 deaths each year. And then when you look at our more vulnerable patients, the seniors population, 70% of the hospitalizations are due to influenza are in that seniors population, and 91% of the deaths. So very important that we get this specific group vaccinated because of the consequences of influenza infection in them specifically. We actually started offering immunizations back in 2012, and you can see how quickly it ramped up. The data suggests now 2018-19, over 3.2 million flu shots have been given in pharmacies that year. 2017-18 was also a very important year. That was the first year pharmacists gave more flu shots than physicians. So we very quickly nationally changed the expectations of patients for where they were historically going to their physicians' offices, public health clinics to get their flu shots. They're now coming into pharmacies, and that number is growing year over year. We expect this year to be an extremely busy flu season with everything going on. Probably going to get well over 3.5, maybe approaching 4 million flu shots nationally. So I think a good news story there for pharmacists. The public is really embraced the program. The vast majority of immunizations being done in pharmacy are still for flu. Like I said, most jurisdictions will start for flu and then expand to other immunization programs. But 93% of the visits for injection are still due to flu. That 7% is slowly growing as more and more provinces expand their programs. So we hope to see pharmacies the destination for most vaccines in the next 4 or 5 years as the public gets used to that as well. So when we, as a group, the Ontario Pharmacy Research Collaboration had a number of goals, and we wanted to show that pharmacists were able to improve overall immunization coverage nationally. So I'll show you some of that data that we had from those early days. We wanted to make sure that offering this service in pharmacies helped to reduce flu-related complications and actually help with healthcare costs. So I'll show you a brief economic analysis that was done a few years back. We wanted to make sure that patients, we wanted to find out what they were saying about the service. Did they like it? Did they not like it? What was some of the feedback they had? And then what were pharmacists saying about being able to successfully integrate this into practice as well? So we'll touch on some of those goals that we set and what happened. And I told you that 2012-13 was kind of the first year that we started offering immunization programs in pharmacies, flu immunization programs. You can see that the trend prior to that was actually the number of patients being immunized by physicians was actually going down. And then almost immediately after pharmacists were able to provide the service, you see that the access and convenience is a huge driver there. We were able to reverse that trend almost immediately. And I showed data already that says we're now over 3 million flu shots in pharmacies. We saw a clear uptake. This is Ontario data. We started at 250,000 vaccines that first year, getting well over 1 million. The reason I show this slide is that number at the bottom, the number of pharmacies offering the program. You see there are 2,600 pharmacies. The opportunity here is there's over 4,000 pharmacies in the province of Ontario. So I think the question should be asked, why are not more pharmacies taking on this service? Why are not more pharmacists immunizing themselves? So that's something that we've explored over the last few years. We have some insight already going into the flu season coming up that the number of pharmacies may now even be less. Some pharmacists hesitant to offer the program because of COVID and the PPE requirements and everything else. So we'll see how this flu season pans out. But for those pharmacies that do offer it, I imagine they're going to be extremely busy with respect to the number of shots that they're offering. One of the other concerns that the physicians had early on, in any country that is considering offering immunization programs through pharmacists will always have this debate, is are we taking away services from physicians? Are we just moving them from one bucket to the other? And that's one of the things we wanted to quantify real early on. You see kind of in that 2013-14 calendar year there, blue or purple there is the number of injections done in Ontario by physicians. Green is pharmacists. Yellow is public health offices and whatnot. And you see that the number of injections given by physicians didn't change dramatically. What we did see was we saw an uptake of an incremental 500,000 immunizations in those early, that early time frame there. So we were having a net increase of flu shots. We weren't just taking them from physicians. There wouldn't have been anything wrong with that because it would have been freeing up physicians' time. But we really wanted to show that we're actually increasing coverage rates or increasing the number of patients that were getting vaccinated. And we're able to quantify that actually very, very early on. There has been subsequent work that's been done now that's shown definitively in those jurisdictional regions where pharmacists offer immunization services, the overall coverage rates go up. So I think good news story, setting the template for those other countries that want to offer the service. If you give patients more opportunity to get vaccinated, many of them will take you up on that. So overall, net increase in immunization rates. What else? The other thing we wanted to see was there a difference in the type of patients? Who was going to a physician? Who was going to a pharmacist? It would helping identify these demographics may help with our marketing campaigns and everything else. What we saw really early on as well is those patients that tend to go to their pharmacists are younger, tend to be non-immigrants, live in higher income neighborhoods, get immunized kind of November, December, January, generally a little bit later, but they've had services in pharmacies before. An opportunity for sure are these patients that are still going to the physician. They tend to be the older patients, the seniors, immigrants, lower income neighborhoods, but had an emergency room visit in the past or a chronic disease. So a lot of the work we've done in more recent years is to try to get those patients in that bucket that are still going for their physicians, targeting them specifically, finding out what the challenges are. Is it awareness? Is it lack of trust? What exactly is it that's forcing them still to go to the physician, and how can we draw them into a pharmacy to get their service or their immunization done by a pharmacist? So I think with respect to our first target, I think we showed an increase in provincial immunization numbers. We were able to identify who these patients are that are coming to us: younger, healthier, wealthier, pharmacy-engaged patients. The gaps in opportunity are still reaching the more complex, vulnerable patients. And then, do we have more capacity in the system? And it seems like we do, with only half of the pharmacies offering these services. So how do we get more pharmacists to come on board? Second thing we wanted to show is the economic impact. Was there value in doing this for the healthcare stakeholders? Was it worth the incremental costs? And I think this economic analysis we published now a few years back, but it does show that, hey, there is a value when you offer this to pharmacists. Pharmacists, in Canadian dollars, it costs about $12.93 for a pharmacist to give an injection, a little bit less than the physician. They're a little bit more expensive there. The cheapest avenue is still public health clinics. The challenges with public health clinics are they're not as accessible. There's long wait times. They're spread out kind of sporadically. So the pharmacy being definitely the most convenient source. And what we did, we looked at that data, that early 2013-14 data, where we added an incremental 500,000 flu shots. And we said, well, to do that, there's a cost. It costs about $5.7 million. You have to pay for that. But there's also an immediate savings in kind of direct flu-related outcomes, less visits to the doctor, less hospitalizations and less deaths. So you save some money there. Where you get the real savings, and that comes at a societal level. One of the other speakers spoke about the time required. You got to take half a day off work to go see your physician. You don't have to do that to go see your pharmacy. Most pharmacies offer vaccination around the clock. You could come into my store at midnight. And then the savings that come from not being off work because you're sick, so time lost due to illness. So when you factor all that in, there was an incremental savings of about $3 million, even though there was that initial investment to get these additional patients vaccinated, and not to mention the savings with respect to lives and illness and everything else. So we were able to show that with our economic model, and I think that's been used as a template elsewhere now as well. So how did we do with Target 2, reducing the complications and costs? I think we were able to show that, saved about $3 million that year. The more flu shots you give, the savings become more pronounced as well. So I think overall, a good news story, again, for pharmacy being the avenue to offer these programs through. One of the other things we wanted to try to capture, so we have all these patients in our pharmacies. I mentioned the seniors already. Why aren't they getting vaccinated by their pharmacist? So we wanted to identify that early on. We conducted a survey in 6 kind of community pharmacies where we identified these patients and asked, hey, what exactly is going on? And what we found was interesting. A third of the patients said they didn't know that pharmacists could administer flu shots. So we had an awareness issue, and this was early on. I still think this issue exists. It's getting better. We are becoming a destination for vaccines, but there's still a subset of patients, cohort of patients, that are surprised that we offer this service. When we asked them the main reasons why they had not previously gone to the pharmacist, you see there they're used to getting it from their doctor or nurse, more convenient at their doctor or nurse. But 42% said overwhelmingly, I don't want or need a flu shot. So I think what came out loud and clear is that we still have a huge issue with vaccine hesitancy. and how are we going to crack that nut with these patients and have them kind of understand the value of getting a flu shot. When we asked them what changes might increase their willingness to go to a pharmacist, more flexible hours, shorter wait times was listed, a few of these things. But again, you see 34%, nothing will get me to go to the pharmacist to get my flu shot. So they're not getting a flu shot. They don't want to get a flu shot. So vaccine hesitancy, again, an issue. How often you get a flu shot? You see there, 37% said never. Where did you receive it last year? 53% said nowhere. And then where do you intend to get it this year? 40% said nowhere. So I think loud and clear again, we have to deal with this hesitancy issue. I think pharmacists could play a big role in that, in vaccine advocacy and making those clear, strong recommendations. And we did see that in the survey as well. Would you be willing to get a vaccine recommended by a healthcare professional? 61% said likely or very likely they would if they got a strong recommendation from a pharmacist, physician, nurse, or whatnot. So I think the story here is when you get back to your practice, make sure you're making those recommendations for vaccines because you own that relationship with the patient and they will take you up on it. So how did we do with that target? I think we found there is definitely some opportunity to enhance public awareness, vaccine hesitancy, a key role, but patients will listen to their healthcare provider if you make that recommendation. So the data supports that definitely. One of the other things we wanted to do was see what did pharmacists think about this new service. Was it something they wanted to do? Did they like doing it? 4,300 community pharmacists in Ontario, and we asked them about a bunch of those questions about what they thought. And they very clearly said they were getting comfortable with flu and they wanted to administer, they felt they could administer other vaccines. The vaccines they most commonly thought they would do successfully were pneumococcal vaccine, shingles vaccines, and then the travel vaccine. So they felt they, were positioned well to offer those vaccines to patients. When we asked them what were some of the barriers and facilitators to offering immunization services, well, they said, hey, we want to improve overall patient health. They liked that. They wanted to demonstrate a new role. They felt offering immunization services gave their pharmacy a competitive advantage. The barriers were always the same, and you see this in multiple surveys, time and workflow. So in a historical or traditional pharmacy where you're very focused on dispensing, it's very hard to offer sustainable vaccination programs if you don't change your workflow. You have to invest a little bit of time, invest a little bit of staffing to be able to build and develop these programs. So it's not so cut and dry as I'm going to offer immunization services and you flip a switch. You have to give the support to the pharmacist so they can do it sustainably. We find people being able to walk in and get their flu shot whenever is what they want. They don't want to make appointments. They don't want to come in during specific windows. We are offering them, for the most part, around the clock whenever the pharmacy is open. And because of this work, the health minister at that time made the announcement, pharmacists are doing a great job with flu. We're going to offer a bunch of other vaccines through pharmacies as well. And we saw that back in 2016. And why this is interesting is this is the same route we see in almost every country where pharmacists become involved in immunization services. It starts with flu, they prove their success, and then expands out to all these other vaccines. And now we're able to give all these vaccines in our pharmacies. Some require prescriptions, some don't. But for the most part, patients are able to get all of them in pharmacies if they need to. So what about globally? What's going on in other parts of the world? That's kind of the Canadian experience. I think we know FIP published a white paper about a year and a half ago. There's about 2.8 million practicing pharmacists, over 4 million registered pharmacists. We're a huge and excellent resource for patients, a convenient resource for patients, and probably the most accessible healthcare provider. The message there by FIP was we have to engage pharmacists to offer these immunization programs globally. In those countries that are already doing it, they've shown they can do it safely and responsibly, and we've had a lot of success with it. This map here shows countries where pharmacists are already involved in immunization advocacy, and those are probably the easiest places to start. Some of them are already offering immunization programs, others aren't. The FIP white paper was very kind of clear in describing what was going on in different countries, because before this paper, we didn't really know. There was a mishmash of work going on in different regions, but it never had really been documented anywhere. And you see the timeline here. First country to really have pharmacists immunized was back in 1983 in Argentina, and it's kind of been a slow trail since then. Canada going live, like we said, kind of back in 2012, and then countries coming on board even since then. So this hopefully this timeline will continue to fill up with countries where pharmacists are able to offer these services. Some examples from around the world. We know Ireland there trying to get to a 75% target for flu in older age groups. In the 2014-15 flu season, they did over 50,000 patients, 1 in 10 patients being vaccinated by their community pharmacy. Since then, pneumococcal and shingles vaccine has been added following that kind of trend that I was already discussed. The UK, same thing, changed legislation to allow pharmacy-based vaccine administration, increased focus in driving patients into pharmacies for that. And what they found now, even in those patients that are eligible for state-funded vaccination by their doctors, they prefer to go to the convenience of their pharmacies, even if they have to pay out of pocket, because they don't have to take a day off work or they don't have to make an appointment. So again, I think the same trend that we're seeing in other parts of the world. Portugal taking a similar route over a longer period of time, changing the scope of practice back in 2007 to allow for vaccine administration in pharmacies. Undergone a training model similar to the American Pharmacists Association. Training is a key component of any country that wants to offer vaccination programs through pharmacies. A nice development in 2012 where they adopted a mandatory electronic record. We still don't have that in Canada. I think it is a challenge when you have multiple healthcare providers offering immunization. There's no one without an electronic record. It's very hard to keep the documentation and the patient record up to date. So we're finding that challenge now in Canada, and we're kind of pushing towards this. And then obviously pharmacies here in Portugal are still requiring prescriptions, but having pharmacists able to offer the vaccine. I'm going to switch gears a little bit. We talked a lot about flu. This is a paper that's in review now. I thought it was worth sharing because it speaks to the role that the pharmacists can play in vaccines other than flu, but at the same time, the opportunity that we have to increase vaccine adherence rate. What we did in this study is we pulled data and we looked at patients that were getting multi-dose adult vaccines. So these are vaccines like Gardasil that requires a few doses, or Twinrix, or anything that required more than one dose. And we wanted to see what percentage of patients in Canada completed the entire regimen. And I think the number I'm showing was a very robust patient population side, 351,000 patients distributed from coast to coast. And what we found is only 32% of patients completed their entire regimen. So as pharmacists, we're leaving a lot on the table. These are patients that are getting their first dose, but they're not coming back for their second or their third. So really speaks to, I think, pharmacists having this information in their pharmacy database, being able to identify them and offering reminders to get these patients in because they are vaccine-friendly patients. So I think a huge opportunity here as well. When you look at adherence by province, there was some variability, but not much. Very consistent from coast to coast. So around that low 30 range with respect to whole regimen adherence. So I think the robustness of the data coming out here as well. Kind of the second thing we wanted to do was we wanted to see, was there any difference in adherence if the pharmacist gave the injections versus the physicians? And what we found was a very clear trend as well. The blue is in favor of the pharmacist, red is in favor of the physicians. You see nationally a slight kind of increase in favor of the pharmacists at plus 1%. But what do we notice of those blue provinces? We see Alberta there, British Columbia, Nova Scotia. Those provinces have had immunization services for longer and have the most expanded scope. So we made the argument in the paper that if you give pharmacists a scope, you allow them to immunize, the longer they do it, the better they get. And you see some of these increases in adherence rates, plus 12, plus 8, plus 6. These amount to huge absolute numbers. And I think overall will have a dramatic impact on public health. So I think this data in review now, when it's published, I think may help to shape some decision making amongst stakeholders. So what's next, I think, for us? Well, definitely continue to evaluate the impact of the pharmacists. Some of this work was done a few years ago now. Run the data again where we go. Practice change is always a challenge. It's still a challenge even in those countries where they have the most advanced scope and they're used to doing this. Vaccine hesitancy, I think, is a huge issue. I think it's going to take healthcare providers working together to really tackle that issue. We're seeing a lot of resistance to vaccines kind of in the media in the more recent years. So we'll see where that goes. And then targeting those high risk, high users, vulnerable patients. How do we get them moving into pharmacies? I think that's also an opportunity. My point here is simply offering scope to pharmacists isn't enough. It's building the programs around it, providing the education, making sure pharmacists feel comfortable and confident to offer the service. And I think that's where we have an opportunity. I think then the programs will work. So it's making sure people know about it, showing them the value of it, and then having patients demand the services, get into pharmacies, ask for them. And I think only then will you have a very, very successful immunization program. It's something that's a work in progress in Canada. As you see, we have opportunity, I think, globally as well. But as a whole, I think pharmacists can play a huge role here, and the data supports it as well. So that's it from my perspective. There's some of my contact information there. If you have any questions, I'd be happy to answer them. If you want to scan the QR code, there's a podcast there where we discuss some of these issues in a little bit more detail. Other than that, I think I'll stop sharing my slides and shoot it back to Dan.
Okay, brilliant. So thank you, Dr. John. That was a wonderful presentation. Really great to hear the detail from Canada and also the global perspective as well. So thank you for that. We will pause now for a couple of questions. I believe there is already one in. Is there an international analysis that can be used in advocacy? I've seen that the biggest argument is that there is no analysis on how much this costs, how vaccine distribution chain will change, and how do you report vaccine AEs in this method? So is there any analysis in terms of the advocacy that can be referenced?
That's a great question, and really no. And I think that was the challenge. I think FIP, which is kind of the World Pharmacy Organizing Body, put out a white paper. It's about 1.5 years, 2 years old. The point of that was just to identify who was doing what. Prior to that, we didn't really even know, what was being offered in pharmacies globally. There was no kind of consensus, and there was no group that was collecting that information. So at least that was a start. They use many case country examples of how they kind of proceeded through the process, but really beyond that, there isn't. So I think it's just at this point, looking at the data that's coming out of Canada, US, UK, Australia, what their experience has been, and using that to drive change in other countries globally that haven't offered this service yet. But we have good data now, and it's popping up from all over. And I think it's not a matter of whether pharmacists can do this or whether they have the impact. It's making the legislative change that allows them to do it, I think.
Yeah, absolutely. Brilliant. So we have another question. What are the barriers you foresee for pharmacist-initiated vaccination programs in APAC, given the structure of our healthcare systems over here?
Yeah, so I mean, I think Yeah, I may not be the best person to answer that question, but I know the challenges are always the same everywhere, and it depends on your workflow, the time that's allotted to the pharmacist, and then how do patients perceive it? Is this something that they would be prepared to receive in a pharmacy, right? And that's always a barrier because if the patients don't realize or want to get the service in a pharmacy, it doesn't matter if you have the legislation in place to do it. They won't go there. So I think it's how do they perceive the pharmacist? Do they perceive them as a healthcare provider? Would they be willing to get that service? And is the pharmacy set up to do this? And I'm not an expert in how your pharmacies are set up in that part of the world, but I do know it took a lot of change in North America to get pharmacies set up to be able to offer this. You need a private counseling area where you could give these immunizations. You have to make structural changes to the pharmacy. They have to be big enough to accommodate this. Imagine now in the era of COVID, we're going to have lineups to get flu vaccines where we have to have social distancing and whatnot. Like my busiest store will do 4,000 flu shots in a season, right? So think of the work that's involved in that. And it's amplified when you have to wear PPE and everything else. So I think, yeah, there may be someone better suited to answer that question for your part of the world specifically. But I think generally we've seen the barriers are always the same.
Brilliant. Thank you. That's really useful. Lots of people thanking you for the presentation. So thank you for that. Another question here from Benson. What would you say were some of the regulatory challenges in Canada when implementing a pharmacist-driven vaccination program?
Yeah. So unfortunately, a lot of the laws were written like a long time ago, so it did take quite. We're self-governed pharmacies, and we have a self-governing body. So we have our colleges. The colleges themselves have to mandate the change first. Then the provincial governments have to implement it into the legislation. So it doesn't happen overnight. There was a lot of lobbying that took place. There's delays. Once the college is mandated that this was something that we could do with competence and confidence, that was enough to kind of lobby the provincial governments to change the legislation. But that process takes over a year just on its own. We're under the same path right now in Ontario for minor ailment prescribing, so pharmacists will be able to prescribe medications for minor conditions, things like contact dermatitis, diaper dermatitis, cold sores, stuff like that. But they're prescription items. But again, it's been a 2-year process and it's still not in place, right? So it does take a while to get the legislative change put in place that's required.
Absolutely. Brilliant. Thank you. 2 more questions. So in Canada again, what role do nurses play in delivering vaccines to patients?
So if you get your vaccine in a doctor's office, you're most likely going to get it from a nurse. It's not the physicians giving it. Many physicians employ nurses or nurse practitioners that help in office. So they're generally the ones that do. But historically, we had what were called public health clinics. So these were like clinics that were set up kind of seasonally to give flu shots. This was prior to pharmacists doing it. And nurses would be the ones that would give the vaccines then. At this point, public health clinics are gone. All that is kind of diverted to the pharmacist. So the only place you'll see a nurse giving it is in offices. Occasionally, pharmacies that are very busy and don't have the pharmacist staff to do it, they may employ a nurse that does them in pharmacies as well. But that's not common anymore. I find it's exclusively the pharmacist.
Okay, yeah, great. And the last question, in terms of, again, in Canada, how many national influenza centres are there in Canada, and what role do they play as part of influenza surveillance? Would you mind throwing some light on surveillance and monitoring in Canada?
Yeah, good question. I mean, each province has their own. So, like, there's a national program, but generally each province has their own. And then there's actually local surveillance that happens in the bigger cities also. So I think it's multi-level. Starts federally. branches down provincially, and then we have local surveillance programs as well. You could go online and see how flu is tracking in Canada, pretty much the entire flu season, see if it's hit your community, which helps pharmacists scale up their labor. I find I use that tool just because I know when it's coming. You're going to have to ramp up the number of staff you have in your pharmacies to be able to manage the eventual kind of onslaught of people looking for vaccine. It's always the same. Until it hits the media, it's a small trickle, and then everyone comes at once.
Absolutely.
Yeah.
Brilliant. So I think that's all the questions. Dr. John, thank you so much again for joining us. That was a really valuable presentation, and it shed a lot of light and granularity on how things work in Canada and the rest of the world. So thank you for joining us. Appreciate it. It's the evening with you. Yeah, thank you again once again from us.
Thanks so much, guys. Great to be here. Enjoy the rest of the program.
Brilliant. Thank you.